Hello, my name is Dr. Susan O'Brien, and I'm the Ashbel Smith Professor in the Department of Leukemia at the University of Texas MD Anderson Cancer Center. There's some questions I'm often asked about CML that I'm going to discuss with you today. One is, what should the standard workup for newly diagnosed CML include? It's very important to include a bone marrow, even though nowadays we have PCR and FISH and things that we can do on the peripheral blood. So why is that important? Well, there are a certain percentage of patients with CML that actually will present with accelerated phase, say that have increased blasts in the bone marrow. And if you don't have the bone marrow, you're not going to be able to identify that population. You also want to do standard cytogenetics in addition to the PCR. Why is that? Because every once in a while, I'll encounter a patient who's not responding to frontline tyrosine kinase therapy, and it turns out that the diagnosis was made based on a false positive PCR. So again, it's very important to have the baseline cytogenetics to identify those patients. The other thing that you get with the cytogenetics that you won't get with the PCR is any information on baseline clonal evolution, which also affects the prognosis of the patient. So we need to have, of course, a physical exam, looking in particular for splenomegaly, the blood counts, which often will be what lead you to think about the diagnosis of CML, a bone marrow aspirate, and in addition to PCR, which can be done in the peripheral blood, we need the baseline cytogenetics to be done on that bone marrow sample. Thank you for your attention.